What if I told you that most home health agencies are unknowingly losing thousands of dollars every month to preventable cash flow problems? In the next 6 minutes, I'm going to show you exactly how to improve cash flow home health operations and transform your agency from struggling with late payments to maintaining predictable revenue that supports sustainable growth. Home health agencies across the country are facing a financial crisis that's threatening their ability to deliver quality care. When payments arrive weeks or months late and accounts receivable balloons beyond manageable levels, agencies find themselves trapped in a cycle that impacts every aspect of their business. But here's what most agencies don't realize. These cash flow challenges aren't just bad luck. They're the result of specific fixable problems in how agencies handle their revenue cycle management. And once you understand where the money is actually going, you can implement targeted solutions that generate immediate improvements. Let me paint the picture of what's really happening. Unlike other healthcare providers, home health agencies must navigate complex payment structures, lengthy reimbursement cycles, and increasingly aggressive payer scrutiny that can leave money tied up in accounts receivable for 60 days or more. When your accounts receivable over 90 days starts climbing, it creates a devastating domino effect. You're delaying payments to staff and vendors, triggering compliance audits, and watching growth opportunities slip away because you can't access the revenue you've already earned. The financial impact becomes even more severe when you consider that many agencies operate on razor-thin margins. Extended payment delays force agencies to take on expensive lines of credit or factor their receivables at significant discounts, which further erodes profitability. Now, here's where it gets really concerning. Most home health agencies are still relying on basic billing processes that were never designed to handle the complexity of modern reimbursement requirements. Without specialized knowledge of home health billing regulations, agencies often submit claims with errors that trigger immediate denials or create compliance risks that can result in audits and recoupment demands. The challenge multiplies when agencies try to manage billing internally without the deep expertise required for home health revenue cycle management. Documentation requirements, coding complexities, and payer-specific submission rules create a perfect storm for delayed payments and reduced collection rates. So where exactly is your revenue disappearing? Let me show you the 3 biggest leakage points that are probably costing your agency right now. First, documentation and coding errors. Home health billing requires precise documentation that supports medical necessity and demonstrates compliance with Medicare conditions of participation. When documentation fails to meet payer requirements, claims face immediate denials or requests for additional information that delay payment for weeks. But coding errors are even more expensive because they don't just delay payment, they can trigger audits that result in recoupment of previously paid claims. Healthcare providers across all specialties are experiencing increased claim scrutiny, making accurate coding more critical than ever. The financial impact compounds when agencies lack systems to track and correct these errors quickly. Claims that could be resubmitted within days often sit in denial queues for months because agencies don't have the expertise or bandwidth to address them systematically. The second major problem is poor denial management. This creates a cascade of cash flow problems that most agencies completely underestimate. When claims face initial denials, which is increasingly common in today's payer environment, agencies need robust processes to work these denials aggressively before filing limits expire. Here's a shocking reality. Agencies without dedicated denial management resources often see 5% or more of their billed charges written off as abroines uncollectible, rather than fought for recovery. That represents revenue that was earned through delivered services, but never collected due to inadequate follow-up processes. The third critical issue is prior authorization challenges. When services are delivered without proper authorization, or when authorizations expire without timely renewals, agencies face the risk of complete claim denials for services already provided. Medicare Advantage Prior authorization requirements continue to evolve, creating new complexities that agencies must navigate to ensure payment. Agencies that fail to stay current with these requirements often discover authorization problems only after claims are denied, creating immediate cash flow shortfalls. Now here's what's really holding agencies back from solving these problems. Most home health agencies operate with billing systems that weren't designed for the complexity of modern revenue cycle management. Legacy systems often lack the reporting capabilities needed to identify problems early or the integration features required for efficient claim processing. Without sophisticated reporting tools, agencies often operate blind to their revenue performance until monthly financial statements reveal problems that have been building for weeks. This reactive approach means cash flow issues are discovered after they've already created operational challenges. But here's what changes everything: real-time visibility into key performance metrics. When you can see days in accounts receivable, collection rates, and denial patterns as they happen, you can manage proactively and prevent small problems from becoming major cash flow disruptions. Home health agencies generate enormous amounts of billing data, but most lack the analytical tools needed to transform this data into actionable insights. Without proper analytics, agencies can't identify which payers are causing the most delays, which services face the highest denial rates, or which documentation patterns correlate with faster payments. So what's the solution? Developing a comprehensive strategy to improve cash flow home health requires understanding that revenue cycle management is a strategic business function, not just a back-office operation. Exceptional home health revenue cycle management requires deep operational experience combined with robust data analytics. You need teams that understand not just the technical aspects of billing, but the operational realities of home health service delivery and how documentation practices directly impact revenue outcomes. The most successful agencies work with revenue cycle management services that combine decades of home health operational experience with sophisticated data analytics to identify and address revenue leakage points systematically. This knowledge-powered approach enables agencies to optimize every aspect of their revenue cycle, from authorization management through final collection. While building a comprehensive strategy takes time, there are specific tactics you can implement that generate immediate improvements. Most agencies have significant opportunities to accelerate collections on current accounts receivable through a systematic approach to outstanding claims. Working accounts receivable aggressively can reduce days in AR by 20% or more within the first 90 days of implementation. This directly translates to improved cash flow and better working capital for your agency operations. The key metrics you need to track are collection rates across different payer types and days in accounts receivable. These metrics provide early warning signs of potential problems and validate the effectiveness of your improvement initiatives. Agencies that maintain days in AR below industry benchmarks enjoy predictable cash flow that supports operational stability and growth investments. This performance advantage compounds over time, creating substantial competitive benefits. Here's the bottom line. The ability to improve cash flow home health operations depends on implementing comprehensive revenue cycle management strategies that address the specific challenges facing home health agencies. Success requires more than basic billing services. It demands deep operational knowledge combined with sophisticated data analytics to identify opportunities and drive systematic improvements. Don't let another month pass watching your hard-earned revenue sit trapped in accounts receivable. Contact us today for a free consultation where we'll show you exactly where your agency is losing revenue and demonstrate concrete opportunities to improve cash flow home health operations through our proven methodologies. Make sure to subscribe for more insights on optimizing your home health operations. Drop a comment if you're dealing with any of these cash flow challenges, and check out our next video where we break down the exact documentation strategies that get claims paid faster.